And while they're getting seated, Gary and Michael, thank you for generous introduction, and more importantly, the privilege of being able to serve on this panel. It's really an amazing treat, especially this transdisciplinary team that's finally bringing engineering and medicine and sociology together in very meaningful ways. It's just fantastic to be able to learn with and collaborate with each of you. As we all know, that the VA waiting issue brought to light the needless suffering, the disrespect, and the waste associated with wait time. And that light is by no means limited to the VA. It permeates most of our healthcare systems, just as Katrina brought poverty to light in New Orleans, and it's just as strong in Baltimore or Birmingham. And yet amongst those dark spots, there's many bright spots where work has just been breathtaking, and you will hear from some of those today. And as you're hearing those, I would ask you to keep in mind, yes, the technical work that they did, and this is a systems engineering, but I think what even is a deeper level in that is the stories that they told and their organizations told to allow these changes to occur, because underlying these system changes are the stories that either propel us to new pinnacles or keep us pinned to our current performance. And these amazing organizations, you'll see, have really told new stories for all of us. So the panel today will be 3 10-minute presentations and then a 45-minute discussion. We have worked with all the panelists to make sure we stick to 10 minutes so that there's plenty of time for open dialogue. The first approach will be Mark Hallett from ThedaCare, and we'll be discussing their amazing ambulatory approaches to reduce wait time. Next, we'll have David Creer and Tara Thompson from Cincinnati Children's talking about the hospital-based approaches. And finally, you'll have David Gettinger talk about the IT tools to support that. So please listen to these stories, see the theories that underlie them, and then call out what we can do to do better. Their bios are all in here. They're very accomplished, but I prefer to give them time to talk and for you to hear so you could read their bios. We won't go through and introduce them if that's okay with each of you. Okay, so Mark.